Well, good afternoon, everybody, and welcome to the second in our series of webinars with our partners from the Michigan Department of Health and Human Service, a tobacco cessation division. I think there's a variety of names or of different groups that folks are from, but we are here to deepen our work and our understanding around what we can do as school leaders to be ready for, understand, and then address in a way that matters to our students and that is consistent with best research around use of tobacco products, vaping, cigarettes, etc. And we are really, really thrilled to have a wonderful panel of experts with us today. We have Dr. Brittany Tayler, who is an internist and pediatrician and practitioner in Flint, and also works with Michigan State University, as well as Tom Moore, who is an MDHHS tobacco section public consultant. And I've got to experience Tom's work and some of the research and the coordination that he does. And we're really, really excited to have these two on today to talk about what are the emerging nicotine products that your students, that our kids are getting. What are the trends in youth health that are occurring as a result of that? And what do school leaders need to really know about regulations and what's going on to make sure that we are ready for this? And I know it's the end of the year, and principals are literally in that race to the end with senior events and everything else. So we know how valuable your time is and appreciate you taking it out of your day for this. As always, these webinars are recorded. They will be shared out after the fact, and there will be follow-up emails that come out after this. But with that being said, I am not the expert in this one. So, from my perspective and MASSP's perspective, we're grateful to have folks that know a lot more about this than I do out there. So, with that being said, I am going to turn it over to Dr. Brittany Tayler, who's going to begin. And then Tom will jump in later, but we're going to have about an hour webinar. If you have any questions at all, you can throw those into the chat, or you can feel free to drop those into the Q&A, and I will make sure that our panelists see those and that we make sure we answer your questions. So without any further ado, Dr. Tayler, I'll turn it over to you.
Hi, thank you so much for that wonderful introduction and for allowing me to be on this webinar today. This is a really, really big topic, and so I tried to condense a lot of information into a little bit of time. And so I'm really focused on just kind of giving a really quick overview of kind of the nicotine's impact on the brain, particularly adolescent brain, and then kind of highlighting three different tobacco products, e-cigarettes, nicotine pouches, and hookah, which are kind of the most commonly used products currently in the top there. And then just a really quick overview about what current regulations are. So if it seems quick, it's because it's quick. So just a little bit of background about me. I'm an internist and a pediatrician in Flint. I'm the Genesee Intermediate School District Medical Director, actually. So I deal with this a lot. So I'm hoping one of my principals might be on. I also work in the Department of Public Health at Michigan State, and I'm based in Flint. And I don't have any disclosures. I don't have any children yet, but I do have a fur baby. So this is my cat Nugget. So I always just like to see, she's always very amused by all the work that I do and is exhausted by just all the talking I do. So tobacco products, all sorts of different things I think that we think of. And so it's a very broad range and continues to be broad. So you have e-cigarettes, your traditional combustible cigarettes, you have pipes and hookah, cigars, nicotine pouches, snuff, and all sorts of different things. And so I always want to kind of give this broad overview that there's so many different tobacco products, and really we're honing in on just a couple, just because those are being most often used by adolescents and young adults currently. So just giving a broad kind of discussion about how the adolescent brain is impacted by nicotine. So as an overview, nicotine is a neurotransmitter. It is an active chemical, a drug. It's one of the most commonly used drugs in the world, including in the United States, only behind caffeine. Being the most common. So I always want to remind everyone that it is a drug, and it does act on the central nervous system with that. And another thing I always like to kind of frame everything with is that although we always think of adolescence as being mature, at 18 years, that's when you can vote and different things like that. I always want to point out that our brain does not finish developing until up until 25 years. So our sexual maturation finishes around 16, 17, 18, and then our brain continues to develop well into the 20s, which is very different when you compare to like rodents and different things like that, where brain maturation is matched with sexual maturation. And so even though an adolescent may present and look exactly like that they're an adult and fully fledged and, you know, in the eyes of the court of law and different things like that, they are adults, their brain has not finished developing. And this is why using nicotine, is, especially during this age, can have really profound impacts. So the area that we really, really are concerned about when it comes to nicotine is this area called the prefrontal cortex, which is in the front part of the brain. That's why it's called the prefrontal cortex. And a lot of what that part of the brain does is actually kind of serves as a modulator of decision making. It's a big personality driver. It often serves as a brake for other parts of the more primitive hindbrain. And a big thing is that it is one of the last parts that stops developing, completes developing in the human brain. And it's related to the rest of this limbic system, which is this more immature part of the brain. You don't need to know all of these different parts. I just always like to show that there's a lot of different parts of the brain, because you've probably heard the terms amygdala and hippocampus before. Of course, most people don't say nucleus accumbens and caudate nucleus. They're just not as fun to talk about. But they're all very, very important in this aspect of the more immature brain, the more impulsive brain, the one that makes you go eat, the one that makes you, you know, have sex drive, the one that makes you creative, the one that makes you emotive, and different things like that. And that's a lot of what this part of the brain does. And what happens is that the prefrontal cortex actually interacts, and this is kind of a sciencey slide, so I apologize. The prefrontal cortex interacts with the limbic system, so these different aspects of it, in order to kind of temper it. And instead of just going and eating 12 cookies, you might think, probably shouldn't eat 12 cookies, I might get sick after. But it takes the prefrontal cortex acting and to stop that really quick primitive drive from that. And so as you can see from this, those pathways, as represented by the dotted lines, are still very much maturing in the adolescent brain. And a lot of times this is actually what nicotine can act upon and manipulate to actually kind of endure this addiction and kind of change the way that the prefrontal cortex interacts with the limbic system. And because of this, adolescents actually have a different experience when they consume nicotine, which is that active product in tobacco products. So in an adult, a lot of times when you smoke a cigarette or use any tobacco product, you actually have kind of decreased activity. You're not as activated. You're kind of calmed down. Again, the term from the smoke break, you know, you go out and you take a deep breath and sit around. But in adolescence, it can actually kind of be activating and help them kind of focus a little bit more. So a lot of times kids will say, oh, it's, you know, I use my e-cigarette. It kind of helps me focus in on what I'm doing, kind of prep for a test, different things like that. And it's a completely different response because of the immaturity of that brain. Adolescents are also much more sensitive to the rewarding aspects of nicotine. So they're less likely to have withdrawal symptoms and kind of overdoses of nicotine. So if you've ever gotten nic sick before, you've had too many cigarettes or something like that, it's a pretty horrible experience. And I don't think a lot of people think about that as being something you can overdose on. But you definitely can. And if you've ever had it, you know what I mean. And in adults, we're actually much more sensitive to that because our brain has finished developing and can't really absorb that really high level of nicotine. And so we get these more adverse effects from consuming a lot. And then we also will exhibit more withdrawal symptoms when that shift in the nicotine level changes a lot. Because the adolescent's brain has a lot more plasticity, aka it's still developing, it's a little bit more, it's easier for it to adapt and kind of handle different big changes in the nicotine levels. They're more sensitive to these rewarding aspects. They're not going to get as many withdrawal symptoms, and they can tolerate pretty high doses in comparison to adults because of this. There's also this concept, which is, I would say, fairly debated, about if using a tobacco product actually serves as kind of a gateway. So if it enhances the acquisition of using other substances later on, whether that be cannabis, cocaine, meth, and alcohol. There's some fairly strong data around cannabis and alcohol, and if you start using nicotine, you're more likely to use those later on, and specifically e-cigarettes, but others have been sometimes shown out, and sometimes not. So one of the big things and takeaways from kind of really long-term studies around kind of the impact of nicotine on adolescents is that it's been linked to poor memory, attention deficits, and impulse control issues. And again, if you think back to the way that developing brain is evolving, that prefrontal cortex and that limbic system, it makes sense. If the prefrontal cortex is not able to interact with the limbic system, a lot of those things that it's trying to do, form memories, focus on one or two topics, and impulse control can't happen. And because of this, they actually have smaller cortical volumes and hippocampal changes. So again, in the hippocampus and in the limbic system will actually have a tendency to be bigger, and the front part of the brain will be a little bit smaller. Because of this, it increases the risk of depression and anxiety in adolescents, as well as increased suicidal ideation. There's a lot of information about poor sleep quality and quantity as well with this. A lot of this is actually related to e-cigarettes. It's a little bit chicken and the egg. Because of the ease of using e-cigarettes, an adolescent can actually turn kind of to the side when they're sleeping and quickly use an e-cigarette and then go back to bed, as opposed to having like a cigarette where you kind of have to get up. You don't really want to light the cigarette while you're laying down on its side so you don't catch your bed on fire. So again, just a little bit more of the use patterns. That you can have a tendency that more people are using nicotine when they're sleeping, around when they're going to bed, etc. And as I said before, it can be very activating for adolescents, and so that will actually wake you up, and so you can't get back to sleep after. And again, because of the way that nicotine works as an addictive substance, it can create this withdrawal symptoms, so that it can worsen mood and different things like that. And the big thing is that the majority of current adult smokers started before the age of 18. And by majority, I mean 90%. And then you bump that age up to 21, it is 96%. So it is a staggering number of individuals who are using tobacco products started when they were adolescents and young adults, and then continued. And a lot of this has to go to the fact that because that brain is still developing, can actually build in that addiction pathway much easier. This is just a study that kind of talked about adolescents and individuals who had started using tobacco products, both cigarettes or e-cigarettes, as adolescents, and then asked when they were in their 20s, 30s, 40s about their perceptions about remembering and making decisions. And there was a lot of self-reported data in this that showed that if you were using both cigarettes and e-cigarettes, or just e-cigarettes, that you actually had worse outcomes or reported worsening of kind of your remembering and decision making. So again, it's not just something that we're seeing where it's just something we're picking up on a study or a test or something like this, but this is self-reported that these individuals acknowledge and feel this way later on after using a nicotine product for an extended period of time. Some of the health effects, so like one of these articles was literally came out last month, is an ever evolving field with this. And this is specifically for e-cigarettes and their health harms. So there's a lot of discussion around the impact on the heart and the lungs. I think those are the two big ones. The big thing is that nicotine is very active on the blood vessels in the heart. And so it can actually increase blood pressure rates, and has been linked to more hypertension, specifically with e-cigarettes. It's increased the rate of heart attacks, strokes, and other clotting disorders because of this, and changes the way that the blood vessels respond to normal stimuli. Another big thing, and this just came out and it was pretty definitive, showing that individuals who use e-cigarettes can develop COPD from this use. And that's independent. This wasn't with dual use, so using cigarettes and e-cigarettes. It's also been shown to have more coughing, wheezing. If you already had asthma or COPD, poor control of that. There's also something called EVALI, which we don't track as much anymore, but that's e-cigarette and vaping associated lung injury. That was a big thing before before the pandemic. Again, kind of associated more with cannabis vaping, but it's very difficult to kind of parse out that as well. There was also a lot of studies that came out during COVID, whether individuals who were using e-cigarettes were more likely to catch COVID or influenza, and it's been shown that it weakens the immune system in the lungs. There's also some kind of mixed data around the development of prediabetes and insulin resistance, as well as metabolic syndromes with this. A couple other things that have been kind of parsed out in the literature around e-cigarette and their health harms is kind of changes in the oral microbiome. So what sort of bacteria are living there, and so it can make them more aggressive and lead to poor dental health. So more missing teeth, more gum disease, and more plaque, as well as some precancerous oral lesions such as stomatitis, hairy tongue, and colitis. Another big thing is that surgeons have looked into this as well, especially when they're talking about an elective surgery or maybe an urgent surgery. They usually don't want you to smoke cigarettes 30 to 60 days before. And a surgeon, particularly with an elective course, elective surgery, say like a hip replacement, can say, I won't do a surgery if you're smoking cigarettes. You have to stop for 30 days before. And so there was a lot of interest if switching to an e-cigarette for some of these folks might be a possibility. And so they have actually really good data that shows that individuals who were smoking e-cigarettes before going into surgery had more complications, basically, from that. They usually had poor surgical site healing, as well as increased rate of infections after that. And then the other big thing is they had a much bigger increase of post-operative pneumonia. So following the surgery, they're more likely to get a pneumonia after that. Another thing that they've looked at is the increased fragility fractures. So that's usually with folks with osteoporosis or other chronic medical diseases, but they've shown that this can also decrease your calcium absorption, so it can lead to earlier fragility fractures. And again, another area of big interest because smoking is very harmful to a fetus. The OBGYNs were very interested in e-cigarettes as a possible alternative as well. But unfortunately, because nicotine is still the active component with this, it still has very negative impacts on blood vessel formation. And I'm talking too much, so I'm gonna hurry. Okay. The big takeaway from this one is they had Army recruits who have to do these physical fitness tests, and they asked them if they use cigarettes, e-cigarettes, or both. And when they were doing it, they showed that individuals, so ENDS is what they call it, electronic nicotine delivery system here. They showed that they ran the mile slower, they did less push-ups, and they did less sit-ups when they were doing this. And these are young, healthy, otherwise healthy Army recruits that were doing this. And that was a big, big study that they took that came out a couple of years ago. This talks a little bit about flavors. It's not a huge thing. The big takeaway here is that there's lots and lots of different ingredients that they use to make flavors, and they're kind of all over the board. If they're just by themselves without the nicotine, could possibly be increasing inflammation. There's a lot of data around this, and so it's kind of all over the place. And it's very difficult too, because what makes one blue raspberry flavor in one device doesn't necessarily mean that those are the same ingredients that a different brand will. So it's very difficult to say, don't have the butterscotch ones, only have the vanilla ones, or etc., because of kind of the differences in the flavor components. Another thing I always like to point out is that just like with tobacco smoking, with combustible cigarette smoking, you also make an aerosol with this, so it can be harmful to those around them. With e-cigarettes, it's called secondhand aerosols as well as third-hand aerosols. So again, on your clothing, your hair, skin, etc. There's also been a lot of reports about dermal concerns, aka they getting kids ingesting the e-liquids or burning themselves on the products. This is just a really quick overview about some of the most recent kind of trends in e-cigarette and cigarette use, specifically with Michigan high schoolers. And so as you can see, back in 2015, we had a kind of a big bump when e-cigarettes first came on the market. And after a lot of public pressure, it dipped again down to 15%. And then between 2017 and 2019, the introduction of Juul kind of took place, and a huge kind of uptick in the number of e-cigarettes again. And then again, public policy meant to meet this, probably COVID pandemic in there as well. The numbers dropped again. And then our most recent kind of numbers, and these are round numbers. Sorry, Canva doesn't let you do decimal points, so I apologize. They're not the perfect numbers. is back up to about 15%. So we've kind of rebounded a little bit from that and kind of stabilized in the number of high schoolers who are using e-cigarettes. So again, around 15%, according to YRBS. And I always want to point out in kind of how cigarettes kind of mirrored this and has continued to decrease during this time as well as more youth are using e-cigarettes. So cigarettes are much less of a concern. It's less than 2% actually right now. Another thing I always like to point out is this is the percentage of young adults who are using tobacco, who are using e-cigarettes and cigarettes. And so I want to point out that this is 2017. So a lot of these high schoolers that they were looking at in 2015 are now in this age category. And so a lot of this kind of shifted during this time. And so I always want to point out that sometimes I think and this is totally my bias, is that sometimes when we're looking at these numbers, we have to remember that these kids age out. They become young adults. They're no longer high schoolers anymore. So we've lost that when we're looking at that number. So some of the trends might literally just be because they're aging out. Some of it might be from some of the other stuff that we're doing. So I always want to point out that the number of young adults who are using e-cigarettes continues to rise and stabilize, and is actually a little bit higher than our youth and then our high schoolers. And then what about nicotine pouches? This is kind of a busy slide because I think there's a lot of kind of confusion about what a nicotine pouch is compared to snuff, compared to snooze, which is another thing that comes up a lot. And there are actually three kind of distinct entities. So a nicotine pouch is actually kind of almost a synthetic piece of nicotine that's pulled out and put into a pouch, and then you usually put that right in your mouth. You don't have to spit it out, you don't have to spit or anything like that. There's some discussion about it having less carcinogens and less things that may cause long-term health impacts in it. They're currently an FDA authorized product. There's about 20 Zyn flavors Zyn products that have been authorized in the United States from that. And I know I have the youth usage number there, but I have another slide because they just came out with a study like last month showing the increases. And then snuff, which is kind of your typical dip kind of thought, is actually from natural tobacco. So it's an actual tobacco product that you can see here. And then you usually can sniff it. And so that's snuff. That's where the term comes from. And then otherwise it's moist. So you put it underneath the lip and that's what you spit out. And it has very high levels of carcinogens and concerns with this. And so these are regulated just typically as smokeless tobacco products. The number of youth using it is pretty low. It actually decreased a little bit in the last 2 years. And then snooze, which is not a product that's currently really available in the United States. It's something that gets brought up and compared to nicotine a lot, so I like to include it here. It's something that you'll hear about from Sweden a lot. It's a kind of similar to a nicotine pouch in that it's in this little kind of similar kind of device, but it's actually made from natural tobacco as opposed to a nicotine pouch, which is just nicotine and not from the tobacco plant. And again, used in a very similar way, usually put in the mouth. And again, not a ton of great data, just kind of discussing those two. So in a study that came out literally last month, they discussed kind of the lifetime usage for youth who are using nicotine pouches. And I know these are very sciencey numbers. But the big thing is that then from 2023 to 2024, we had a pretty significant increase. I mean, it was statistically significant increase in the number of youth who had lifetime usage of nicotine from 3 to 5.4 in 1 year, which is a pretty big jump. I know those seem like small numbers, but they're not insignificant when we think about the number of youth who are using cigarettes and other tobacco products is very low, and that number who are using it in the past 30 days also increased quite a bit as well. So these are people who are using it, almost 2 to 3% are using it more frequently. And another thing that they looked at is they wanted to see if they were using it as well as e-cigarettes. And so a lot of the individuals who are using some of these products, who are using nicotine pouches, are also using e-cigarettes because they have a lot of dual use with this as well. And what another thing I want to point out is who is using it, because they have pretty good, strong demographic data when it comes to nicotine pouches. So I promise I'm not going to make you stare at this slide for too long. Um, but the big things were if you were older, so if you were more likely if you were in 12th grade, if you were male, if you were white, if you were from a rural location, and if you were not going to plan on going to college. And so those were big things. So almost all of them were statistically significant increases in the number of nicotine pouch use. So a very kind of specific group of individuals who was more likely to be using nicotine pouches than other groups. Another thing I want to talk briefly on, because we have a very large MENA, so Middle Eastern and North African population in Michigan, is hookah. Sometimes it's called hashish or water pipe, and a lot of times this involves inhaling flavors through a water basin. And so this is an electronic version, but this kind of gives you the kind of the basics of how that works. And there's a really common misconception that with the water filtration, that it somehow makes them safer than cigarettes. The water filters out the carcinogens, different things like that. But that is 100% not the case. If anything, it is more harmful than using cigarettes and can be a real issue. So the numbers are very difficult to kind of parse out. They're not always perfectly pulled from some of the bigger epidemiologic studies. And I know that the numbers in Michigan probably are higher just from kind of anecdotal reports and some other smaller data than they are in the rest of the United States. So currently, it's reported that this use is kind of declining to almost less than 1%, but it still remains a pretty persistent number of like 16% of US adults who have used them. And so some of the health impacts that we talk about contains the same toxins as cigarettes, so it has nicotine, tar, heavy metals, and carbon monoxide. There's a lot higher smoke exposure because most people spend a lot longer smoking hookah than they would a cigarette. So usually it's about a 1 hour session, or if you're just hanging out, having a good time with your friends, so it's much higher with that. It's still related to lung disease, COPD, chronic bronchitis, and lung cancer, as well as increased coronary artery disease, which is a precursor to heart attacks, as well as high blood pressure, and specifically oral and bladder cancers. There's always the risk of secondhand smoke when you're in there, and there's also concerns about the risk of infection. So I say shared mouthpieces here, but it's actually in the tubing as well. It's kind of like when people say, "Oh, I'm going to drink on the other side of the cup," you still backwashed into it. It's still sharing a glass. So it's the same thing with the tubing there. And always as a reminder, cigarettes kill nearly 500,000 people every year. It is a leading cause of preventable death. And I always want to emphasize the fact that like these are still tobacco products. They are still from one of the worst things that happened to the US population and continues to be a huge, huge issue. Really, really briefly about Michigan tobacco regulations. I'm going to be honest, but maybe I'm not unbiased because I do a lot of this work in some advocacy portions that there's a kind of a lack, unfortunately, of regulations in the state of Michigan. So we are a little bit farther behind than some of the other states around us. So we do have a minimum purchase age, of 21, which is in line with the federal government, and it includes internet sales. There's very specific penalties for details for use. So the first is usually a $50 fine, as well as some community service and up to a misdemeanor penalties. And retailers have to ask an ID for anyone who looks under the age of 27. In terms of taxation, cigarettes are taxed at $2 per pack. That's been about that at that number for around 20 years or so. And cigars and smokeless tobacco and other tobacco products are at 32% of the wholesale price. A big important thing I want to emphasize, point out is that there is no state tax on e-cigarettes, or kind of nicotine pouches kind of falls in that as well. We also don't have a license to required to sell tobacco products. So anyone technically, as long as you're paying your other taxes and your federal taxes, can sell these products. And so it includes e-cigarettes. And we're only one of 8 states that does this currently. We do have pretty stringent smoke-free air laws. It does only prohibit combustible smoking. Vaping is not really included statewide, though it is pretty much public policy in most places. Hookah lounges and cigar bars are kind of regulated by a series of smoke-free laws. There's specific laws prohibiting self-service displays. E-cigarettes have to be behind a locked counter, as well as mandated postings that are very specific about Youth Tobacco Act signage near the point of sale, and advertising can't be misleading with that. In terms of the federal, I won't belabor this too much. I think it's pretty confusing and almost intentionally so sometimes. The big thing that you need to know is that the federal government, through the FDA, or the Food and Drug Administration, through the Center for Tobacco Control, tobacco products, really oversees tobacco product safety and marketing. And it's a relatively new thing. It was really granted in 2009. So I just want to emphasize this is not something they have always done. This is, 10 years in going. And they were only expanded to e-cigarettes in 2016. They do this through a process called the Pre-Market Authorization Application, or the PMTA. And so it's kind of a very robust series of applications that they have to go through and really prove that they are minimizing youth harms and emphasizing public health. To date, only 23 e-cigarette products have been received marketing orders. There's the only couple flavored products, and they're all menthol. There's no other flavored components, and then the rest are tobacco flavored. I know I mentioned this before, but Zyn was approved earlier in January 2025. And recently the Supreme Court also upheld the FDA's decisions around their PMTA. There's also some federal marketing around tobacco marketing. There's not a ton specifically around e-cigarettes. It's kind of alluded to a lot of the times and kind of followed because of the control, overarching with tobacco products. So you're not really supposed to have TV or radio ads or different things like that. And it's really highly encouraged not to be on social media or online sources as well. There's also a requirement for warnings on tobacco products, specifically with combustible cigarettes. So yeah. So I know that was a whirlwind, so I that was a lot. I have like 7 different presentations, so I try and like hone down and parse into what we need there. So again, I hope that there wasn't too many questions, and I will
Oh,
pass it.
it's a lot, but a lot of really, really good information there. A lot
And I'm
of
happy to share the slides after too. So
Yeah, that'd be great. And
oh
then we'll
yeah.
make sure people get it. But it's interesting to see whenever I see a presentation like this one, we talk a lot about vaping numbers and you see them going down. But even if you're seeing that 2% decrease, there's still a tremendous amount of use going on. And now one of the questions that I had, and then maybe Tom will speak to this a little bit, or perhaps something you want to add on. I know that one of the challenges that we often talk about with vaping versus traditional tobacco use or snuff or the rest is that my understanding is that some of the concentrations of nicotine within there, aside from the adolescent brain development, are also part of that causation of the increased addictive quality of it, etc. When we think about that, is that unique to vapes, or are we seeing that across any of these synthetic use items? Like, you're talking about, the packets also using synthetic nicotine. Is that also more, a higher level of addiction rate, or is it similar to what we'd see in traditional tobacco?
So when it comes to e-cigarettes, it really depends on the brand.
Yeah.
And so I know Breeze is the most popular. I know someone mentioned it in the chat. So
Yep.
those are typically there's 2 different formulations that you can mainly when you go to a gas station. There's like the skinny version, and then there's a little more boxy mod ones, and they have different percentages of nicotine in them.
Yep.
That higher percentage, if you smoke that whole thing, that's about a like almost 2 packs of cigarettes. The one slimmer one is like a little bit less than a pack of cigarettes. I think it's like 20 cigarettes, as opposed to you get 22, 24 in a pack. And then in terms of nicotine pouches, they also come in different varieties as well. Usually it can be fairly potent as well. It's hard a little bit with that because of the way that it's absorbed differently. To say like apples to oranges a little, apples to apples with that sometimes, but
Sure.
typically it can I mean, in a whole Zyn packet, there's more nicotine than there is in a pack of cigarettes, as well. And so Tom might be able to speak to this better than me as well. So
And the follow-up to that question, because it was in the Q&A, there was a question about, like the difference in regulation between e-cigarettes and vapes, like Juul being regulated, but maybe some others are not. And obviously the concern is about those Breeze e-cigarettes, the single use, which are tend to be the ones that kids are gravitating to right now.
yeah. So currently Breeze does not have pre-market authorization. So it's this horrible gray zone where they have applied for authorization and have not. They to the best of my knowledge, because a lot of this happens without,
Sure.
without it being in the public, is that they have been, they have been asked by the FDA to change certain things and redo their application, but they have not formally been denied for certain products. And so that's a big thing. And so in this way, they're able to operate and continue to sell while their PMTA is being reviewed. But no, there are no Breeze products that have been formally approved or technically disapproved. So
That is a
it does
very
happen.
tricky gray area right there.
Yes, yes. And so it's difficult because one may say, oh, they're on the market illegally, but we kind of accept that they have done what is legally obligated of them, and so they can't just stop and wait for the FDA to go through their applications, which they've been doing for many years now, and doing as much as they
And
can. And
I
some
would
of the cut,
assume that with all the changes that are going on right now in federal regulatory
yes.
agencies, that that's also probably slowing this process down if it will happen at all. Is that fair?
Some of the individuals who may have worked on PMTAs no longer work there.
Right.
So it does make the process probably going to be a little bit slower. And it's very difficult too because, and sorry, I can rant about this and I don't want to cut too much into
I was
Tom's
just say
time.
I want to make sure Tom has his time as
Yeah,
well. Yeah.
yeah. So I won't talk anymore. Okay, otherwise I'll rant. So I'll stop talking.
He's giving me the signal. He's like, cut her off, cut her. No, he's not
I
actually.
got the shepherd's hook coming out.
There it
I
is.
know, I know. I'm like, oh no, oh no.
Well, Tom, we'll let you take over for the last 25 or so minutes here. Floor is yours.
Give me 1 second to get everything pulled up. Oh, don't freeze. There we go. Can folks see this? I can't hear anybody.
I can't see it. Maybe
Oh,
I'm on the wrong page though.
let me see. Try this again. How's that? All right. I just can't hear anybody.
Got you. Looks good.
All right. So today my focus will be on LGBTQIA plus youth and vaping. Come on. Give me a second. There we go. Okay. Really quick, I might go through some of these slides a little fast, just be respectful of everybody's time in the presentations today. Just quick things I want to jump through. Mission statement for MDHHS to provide services, administer programs for health and safety. The tobacco program, our mission statement is to reduce the morbidity and mortality and alleviate the social and economic burden caused by commercial tobacco use in Michigan. Really quick about me, I am from the UP. I grew up in Sault Ste. Marie. Got a couple dogs. There's one over here in the bottom. I'm a Pokemon champion, and I've worked in the realm of LGBTQ plus substance use and health for a little over 10 years now. Our objectives today are just going to be short and sweet. In our first section, we're going to look at the rates of commercial tobacco use in Michigan versus the rest of the United States for LGBT youth. Today, we'll be mostly focusing on sexual orientation and not gender identity. We'll get into that a little bit. We're also going to spend just a little bit of time talking about trauma and how it impacts youth's quality of health. We'll also eventually spend some time at the end looking at some ways that principals here can expand your knowledge and help develop networks and resources to help the young people you're working with. I would also like to say Thank you very much for all your services. If it wasn't for educators, I wouldn't be here today. So you are doing a great service while your duties seem to grow and grow and grow. So thank you for your time. Also, I just want to note really quick, we're not going to get through all the terms today. That's a big presentation right now. I took an hour-and-a-half presentation and tried to push it down to 20 minutes. But at any time, if you have questions, put them in the chat and I'll get them to you. And I can always follow up with emails on additional questions as well. I'm not here to change people's minds. We're here to learn and we're here to grow. This is a space for you to ask questions. So don't feel like, oh, this question might be offensive or this question might seem dumb. This is our time to grow together. And my goal for everyone here is to walk away with some new perspectives on the LGBTQIA plus youth, wanting to learn a little bit more and trying to get more tools for your toolbox for resources to help those in your area. So for terms today, we're just going to talk about sexual orientation as one of the big ones. It's the type of attraction that folks feel to other folks. It's often based on sex and gender relationships, and it is very complex. It is not just straight or homosexual. It's not gay. It's not straight. There's a lot of different things out there. And so just to keep that in mind when talking about sexual orientation. The sexual orientation also applies to lesbian, gay, bisexual. We're not going to worry about the rest of the terms right here. When I'm talking about gender identity and gender expression, when I talk about gender identity, what I'm really trying to highlight and talk about with folks is something that is an internal sense of gender. So what do you feel on the inside about what gender is and how you want to identify with that? It does not always match the sex assigned at birth. Now, for gender expression, that's how we all show our gender to those around us. Because of fear and internalized transphobia and gender phobias, some people aren't comfortable being very public and out, showing others what their gender may be. It is based on behavior and speech patterns, hairstyles and clothing, and much, much more. Most of my educational background is in LGBTQ plus history. So learning about this in the past, it's been around for thousands of years. Sexual orientation is not the same as gender identity or gender expression. And that's going to be very important when I go over some data in a little bit. Many people have a sexual orientation and a gender identity. How each person shows it or expresses it is different. There's a difference between gender identity and sexual orientation. It's who you are versus whom you love for that. So just sexual orientation, whom you love, gender identity, who you are. Gender overlaps with sexual orientation, but it doesn't determine it. So just because I identify as more feminine does not automatically qualify me as identifying as bisexual, gay, or queer. So in 2023, Michigan and national organizations in the United States did a tobacco use and LGBTQ, so gay, lesbian, gay, bisexual, queer questioning students in Michigan and across the nation. If you look at the orange in this little data sheet, that represents gays, lesbians, bisexuals, or individuals who self-identified as queer or questioning, versus the blue, which is young folks who are identified as heterosexual. For the national, you will see that folks who identified as lesbian, gay, bisexual, queer, or questioning is around 22%. Nationally, heterosexual youth reported only about 14% of tobacco use. But then if we look at Michigan, lesbians, gays, bisexuals, questioning folks reported 32.2% of tobacco use versus 11% of young folks who identified as heterosexual using tobacco. So you see that there's a big gap between heterosexual individuals and tobacco use and folks who identify as heterosexual versus homosexual. Sorry. So when we kind of pull that back even further, because I often tell folks when it's talking about substance use in particular communities across the United States, there's a lot of layers. And the more layers you pull back, you learn a little bit more about which communities or individuals are using more than others. So if we look at e-cigarettes, so that's the green bars, compared to the orange bars, orange is traditional like cigarettes, we see that folks who are young and identify as lesbian, gay, bisexual, queer, or questioning, the state average is around 24%. The average in the state of those young folks is 24%, versus folks who identified as heterosexual, only 14.6 reported e-cigarette use, which is under the state's average. The average heterosexual young person in Michigan and adults too is around 15.4%. So right here, we're just looking at just how much of a health disparity there is between young people who identify as gay, lesbian, bisexual, or queer versus folks who identify as heterosexual. And so why is that? One of the things I like to talk to people about is not just the numbers. I always remind folks numbers tell stories, and each number has its own why and reason. So when it comes to tobacco use in the LGBTQ plus communities, trauma is something that many of us navigate. And for those of us who've learned or have taken part in like ACE trainings and just completed the ACE scores on their own, we can understand that people are dealing with a lot of stuff in their lives. And I often like to share a trauma and minority stress model when it comes to talking about how external stigmas and traumas can impact an individual over their lifetime and eventually impact not just their mental health, but their physical health as well. So a lot of times external stigmas such as homophobia, transphobia, pop culture, and negative representations on TV and the news is often heard by young LGBTQ plus people. And eventually it can start becoming internalized, not just, hey, I'm a bad person, I'm filthy, I'm dirty, I don't belong, no one loves me. That starts playing a big role in mental health, while at the same time, possible internalization of stigmas. So I often has given the example that when I was in college, I had a whole lot of internalized homophobia because dudes that were very femme acting and gay, I saw them as they're the reason why people hate me and why I got my butt kicked all the time. So instead of looking at the larger culture shaping me to have those feelings, I turned against the community I was trying to belong with. And eventually that can develop behavioral health problems. So substance use as a way of a coping mechanism to feel good for a while, to disconnect for a minute or two. And eventually that will, over the years, impact a person's physical health. That's why a lot of LGBTQ plus adults have a massive amount of health concerns while also navigating insurance issues. Again, what specifics really impact the LGBTQ plus young people? A lot. You imagine it, they're navigating it 10, 12, 15 more times than most of us. A lot of this is intersecting. And so a single young person who I may identify as LGBTQ plus is trying to process all these things, and substance use has helped kind of navigate that and make you feel good for a short while. One of the things I want to point out, predatory marketing. If there's one thing the tobacco industry does very well is understanding the communities they're targeting. They know their target communities far better than a lot of public health and a lot of other organizations out there to focus on tobacco cessation. really can handle at the same time because of funding issues. So back in the mid 90s, people often talk about Project Scum. The tobacco industry was intentionally looking at the LGBTQ plus communities to increase sales. They understood how they watched how well the alcohol industry had did by promoting prides. So what a lot of tobacco and alcohol companies have done over the years is they will provide money to, let's say, a pride event, a other community events like Jet Magazine for African Americans. They knew that these agencies and these programs needed help funding. So they're like, hey, I'll give you X amount of money if you allow us to advertise at your event or your magazine. And so when you're underfunded, getting those funds are really important. And so eventually the tobacco industry started taking symbols from the community, so like pride flags, putting those in their tobacco marketing, not just for adults, but young people too. So over here, we see a lot of the more common ones. They use language like I choose, rainbow, pride, putting folks in their posters that may look like folks from their communities. They've also started working with more non-traditional electric and vaping types of e-cigarettes too. They have also really started leaning into the THC products. So this one right here on the side is a specific type of e-cigarette that it comes out during Pride every June. So when you're trying to get your swag all together, these companies are showing up and being like, hey, look how friendly we are. We also quit gays, lesbians, and bisexuals. Our quitting behavior is very different than other marginalized communities in the United States. Gay, bisexual, and transgender men are less likely than straight and cisgender. So cisgender, the sex you were assigned at birth is what you identify with right now. They are aware of quit lines, but it's not really their thing. Gays, lesbians, and bisexuals are 5 times more likely than others to never even call a quit line. We are much more likely to not have health insurance or health insurance that covers a lot of these products to help quit or reduce your tobacco use. Like I mentioned before, each of these letters in the LGBTQIA plus communities are navigating massive amounts of trauma and mental health needs. And these products understand that. And again, that's why it's much more prevalent in a lot of our communities. And lesbians, gays, and bisexuals often prioritize other things first than their tobacco use. When I first started in Flint, working with people living with HIV, I was a part of the TERP program, so tobacco use and reduction for people living with HIV. And one of the things when I would talk to them about like how tobacco use impacts HIV, they're like, listen, that's bottom of the barrel needs right now. And a lot of young people are like that too. Housing, mental health, food are so much higher on their needs list that they aren't even thinking about addressing their tobacco use. And if anything, their commercial tobacco use gives them time. I've heard young folks report over the years, that's their 5 minutes. Like all that other outside stuff isn't bothering them. It's them getting some time to take a deep breath and have just like some quiet downtime. So what do we do with all of this? First off, be mindful of when you're developing cessation programs or educational materials, what the best practices are out there. The CDC has a best practices model that hasn't been updated in a minute, but it's out there. Reach out to either myself or folks like Dr. Tayler or Grace with any questions or training needs or resources that may help you or your young people navigate this. Be intersectional with your policies and programming. None of this stuff is in a silo. A lot of times it's more than one thing happening, and try to be mindful of that when working with young folks. Use trauma-informed care. Again, being mindful how trauma impacts substance use, especially tobacco use in young people. And then be mindful of community needs and barriers, mistrust, and biases. So a lot of times, a lot of folks who identify as LGBTQ plus are very hesitant to access services because they don't know if they're going to be misgendered or they're going to get a cold shoulder or if they're even going to be allowed services. Like I said, understand the impact of mental health and health disparities around tobacco use in queer youth. Create welcoming and trusting spaces. Having a safe space or at least one person in youth's corner greatly decreases things like suicide, isolation, self-harming, additional substance use. Just giving them a space just to be okay greatly improves behavioral health and physical health as well for a lot of young LGBTQI folks. If you do put posters up, be sure that they're inclusive. Be mindful of students' needs around pronouns and names. Right now, I'm working with two really great organizations that focus on LGBTQIA individuals, and especially young queer youth. Affirmations in Ferndale and Ruth Ellis in Detroit. Affirmations has been doing a lot of great work with young LGBTQ plus people. They have gotten staff tobacco treatment certified, and they go to young LGBTQIA youth camps and have incorporated like tobacco education and prevention in those camps to help young people early on learn and prevent tobacco use. Ruth Ellis in Detroit focuses mostly on Black trans women and Black trans men. They have done a really great job of incorporating tobacco cessation into their ball culture. So if no one knows what ball is, voguing. If you've ever seen RuPaul's Drag Race, every once in a while they'll mention voguing. It's very popular with Black and brown queer communities. Resources. When we send these links out or these slides out, each of these links will take you to all the information I shared from the Trevor Project on tobacco use rates and mental health needs of the community. Our own MDHHS link is in there. I also put together the University of Connecticut School of Social Work. They do a lot of great free CEC certificate. So if any of your staff need any of these things, you can check it out. It's free online courses, so you can look at things about integrating strategies for working with LGBTQ plus clients, improving the sexual health of folks within the community, promoting well-being for LGBTQ youth, and a lot of other like social media stuff if you're interested in learning more. I also put important dates to be mindful of if your school nurses or medical providers are doing anything that are LGBTQ focused, or if you just want to go learn more about these events, you can see what times during the year they are. And then resources for books. I love books. I love learning. Learning never stops. Again, thank you, educators. So there are two little ones that I kind of focused. Unlearning Shame is a book by a young trans person who's a psychologist who talks about how shame impacts all of our lives. And they give their personal story about how they learn to not be shamed all the time. The Body Keeps the Score is a really great one too, when focusing on trauma and how trauma impacts the brain. Not just the brain, but how then tobacco use is mentioned in there very briefly here and there, and other substances, how those work together to impact a person's brain development or like other health needs. And then What's the Tea? It's a book that focuses a lot on trans youth and non-binary youth. And one that I really enjoy because of the terms, and there are a lot, the ABCs of LGBT. It's a great reference book for terms. It's a great thing to learn more or to refer back to. Questions?
So So, Tom, I want to start by thanking you because that's a perspective that I don't think a lot of folks hear on a regular basis and need to. As you talked about, there are particularly higher use rates and
Mhm.
lower cessation rates, particularly in the LGBTQIA community. But one part I would just ask you, and I know we only have like a minute left to go on to, is one of the pieces that you kind of talked about for a second, but I think is worth talking about further is when thinking about any student, whether it's
Mhm.
LGBTQIA or cisgendered kids or whatever else,
Mhm.
like when they're using tobacco, oftentimes it's related to a trauma, it's related to an
Mhm.
addiction, it's a health issue. And you talked about the challenge of access with that. But when we're thinking about cessation in general, I think it's worth taking a second to talk about the fact that this is not something we can discipline kids away from.
Mhm.
And in fact,
Mhm.
oftentimes that reduces trust and reduces the likelihood that they're going to want to go along with this or see it as something that they should do. And your calendar's up. I don't know if you want that. You're
Oh,
still on your screen.
I
It's all right. We appreciate your busyness, but would you like to go a little more into depth into that and what the research that you guys have captured has? And maybe that'll be just a great way to end this, thinking about our next session in a few weeks in June, that is really going to be about shifting gears away from punishment-based practices to more restorative and health-based reform on this.
So for punishment, there are a couple different ways to talk about this. I like to remind folks that a lot of LGBTQIA youth growing up, you may think the homes there, like on the outside, they look like very secure, loving homes, da 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 da. But LGBTQIA youth often could be in homes where they're being abused, but the overall, like what we think an abusive household looks like, it's not fitting. And so there might be a lot of mental health bullying going on at home. And if you suspend someone, you're just sending them right back to that. And so being mindful of that at times, not saying that you know these things or you have to, but trouble at home is something that's very frequent with a lot of queer youth. Um, Punishing, that's the hard thing. Like, how do educators help prevent and stop these things happening on school grounds, but don't just kind of suspend and have it come back? That's, I think that's the golden question. And I don't think at the time we have an answer. Funding is a big thing. Period. Period. Schools have to kind of balance all that out, just like us at the state level with our tobacco funds. And it's hard trying to keep ahead of this because educators, it's not the only thing you're trying to do in a day.
Right.
Um,
One of dozens of things, right? But an important.
exactly. Exactly.
I appreciate
And
that. I don't know, Dr. Taylor, if you want to add on to that too, or tap in on this conversation. I just, like I said, I think it's a nice way to end the conversation today is speaking about, we understand there are these things out there. We understand that some communities are particularly more likely to be impacted by them. But we tend to, in schools, as much as we know differentiation and support matters, when it comes to policies, at the we're at the mercy of what those policies are. And if they give strict, we're going to respond to a first use with a warning, a second use with a 3-day suspension, a third use with a 10-day, suspension pending expulsion, right? Whatever that might be. Any last additions on why folks need to start rethinking that approach?
I always want to emphasize the fact that if if when an adolescent uses a product like tobacco and they know that they're going to be punished, that there's going to be negative repercussions from that, and they continue to use the product despite that, that is the definition of addiction. And when you cannot. I think Tom emphasized this too, but you cannot penalize out an addiction. That's not how you treat addiction. It's never been how we treat addiction. And so the more, and I always, I do talk with a lot of Republican colleagues and other conservative colleagues about this. They always don't want to get them off scot-free, but even a punishment has to come with some sort of connection to resources. And so there's really, really good stuff. I have a whole talk about alternative to suspension programming and what the template language looks like, what that would look like when you do that in schools. And I know MDHHS has tons of help with that as well, and how to actually make that a reality and feasible for schools, because that has to be part of it. Because again, it's an addiction, and a $50 fine does not treat an addiction. So, yeah.
Yeah, no, and I very much appreciate that perspective from both of you, because I think the reality is that many school leaders see that and understand it. I mean, I've talked to folks that are like, we're not even spending anymore because we feel like we're just pushing up against a wall and it's not there where we need to, bring this back together. Tom, do you want to close it out?
Yeah, one last thing for me. If anyone has seen the American Lung Association State of Tobacco Control, each state gets every year a grade from the American Lung Association, and Michigan, of the 5 categories, our best grade is a C, and the rest are Fs. So not just schools, but the state at large needs to start working a
And I
bit
know
more.
we tend to see that, if I'm correct, based on the data I saw last time in the last presentation. It seems like the Midwest as a whole
Mhm.
tends to score lower in those areas. We have higher rates of use. And what they're saying really pairs well. And I know we're a few minutes over time, so thanks for hanging around. But on June 5th, our last of these 3 series before we break for summer, is going to be about rethinking school policies on tobacco cessation, right? And how we can do some of the things that both Tom was talking about and alluded to, and that Dr. Taylor just suggested, right? How we can move away from suspension towards remediation, towards more healthy living, towards helping students find agency in their release from that addiction rather than trying to punish the addiction away, which the history major in me, Dr. Taylor, had to wince a little bit when you said we don't punish addictions away, but we've punished addictions away for centuries, right? Not understanding maybe that that's what we were doing, but we absolutely have, and we're still doing it today. So, on behalf of the Association of Secondary School Principals, I want to thank both of you for your work in this. I want to thank Grace for coordinating this project and being a great partner on it, and we appreciate your information. Again, the next session will be on June 5th. These are free webinars, so if you think this information is valuable and useful, which I hope you do, please tell your friends, have them register as well. This will all be posted after the fact on our website and on our YouTube page in the next few weeks, and we truly, truly appreciate your time in what we know is a busy time of year. So, Tom, Dr. Taylor, Grace, thank you for being here. For everybody who joined, thank you so much as well. Have a great rest of your Thursday and a wonderful Memorial Day weekend. Take
You
care all.
guys have a great one.
Thanks.